Greetings and thanks for joining me today. I'm Dr. Steve Grinstead. Today I want to talk about my book, Thank You Adversity for Yet Another Test, a body-mind-spirit approach for relieving chronic pain suffering. You know, especially in the time we're having now, a lot of chronic pain patients aren't able to participate in their usual pain management activities. I know I'm certainly not. One of the things I do for managing my pain on a regular basis for stabilization and relapse prevention was swimming and aquatic classes. Well, now that's cut out for a while, so I'm having to do other things. And there's a lot of other things. Over the years, I have so many tools in my toolbox. All I need to remember is to lift up the lid, take them out, and use them, and make sure that they're polished and cleaned and working well. So today, I want to offer a 20% discount for watching this video on my book through my publisher's page, booklocker.com. So you'll see the links with this video, and I'd encourage you to take advantage of this. You'll also see a place on the publisher's page to get a free excerpt, which is the first 100 and some pages of the book, so you get an idea what it's like, including the table of contents. I really want to reach out to people and offer them some hope in these troubling times. I was talking to one patient this morning who has had a severe flare-up because of a failed surgery, and now they're calling the new surgery an elective procedure, and she's having to wait. She doesn't want to be stuck on opioid medications because she's been down that road and found out it was a dead end. So I coached with her for a while, and we found some other alternatives. In my book, I give case examples of 4 complex chronic pain patients who went through our program, our residential pain program, before we shut it down. And it's a composite of patients to protect anonymity and confidentiality. And it shows how these patients were when they came in versus how they were when they went out. And more importantly, what they did to achieve those good outcomes. I also used examples of myself with my chronic pain management since 1982 and other patients I've worked with over the years to make it as real as possible, to keep it simple. So again, if you're watching this video, thank you so much, and please make sure to share this with friends, family, healthcare professionals who are working with people with chronic pain, because now the suffering is really extreme and intense for a lot of these people, and they need some new hope, and that's what I want to offer is hope. So thank you, and please, I'll check in with you soon. And for me, you know, this is some of the things I do for my pain management today. I walk 2 or 3 times a day. My wife and my dog, Becca, Ellen and Becca, will go with me. And I also soak in my hot tub. I sit here by the waterfall and do mindful meditations every morning. I read my spiritual lessons and listen to spiritual messages for a while to get myself started. I make my list of at least 10 things I'm grateful for every day. I am aware when my thinking goes in the wrong direction. You know, there's a Zen saying, is let your thoughts flow in through the front door and let your thoughts flow out through the back door, but don't serve them tea. Don't have them entertained and stay. You can let them go. We're powerless sometimes over the thoughts we have, but thought stopping and thought replacing is one of the tools I use, especially when I have a pain flare-up. I also have, for acute pain flare-ups, I have my TENS unit, I have analgesic ointments, some CBD oil without any THC in it. There's different things that I will use depending on what's happening. So again, I'd encourage you to check out my book, Thank You Adversity for Yet Another Test, and take advantage of this 20% off offer I'm giving you for just watching this video. Thank you for joining me today, and may you stay safe and stay well. Onward and upward with hope, love, and gratitude. Thank you.